Welcome back. It is time for some Wellness Wednesday, sponsored by the Health Insurance Place. And join with us now, we've got Kate McKnight, who is an insurance agent over at the Health Insurance Place. Welcome back to the show, Kate.
Good morning. Thanks for having us back.
Yes, we're in open enrollment period now. And you said, of course, you're dealing with a lot of different matters and phones ringing off the hook.
Yes.
One big thing you're seeing, though, is folks not being able to determine when they're getting approached by scammers because they're able to identify their phone number as a local area code, 814, and people don't really know how to distinguish the difference between something being legitimate or fake.
Right. I'm on a lot of those Medicare lists because of what we do for a living. So I get 814 calls from the area code during the day. I'll pick up the phone and it's, are you 65? Do you have Medicare A and B? So for fun, sometimes I say yes just to see what's going to happen. We like to change it up a little bit during the day. And the next thing is we're going to transfer you to a specialist. Those specialists are not licensed insurance agents. So the first thing I do is ask them for their insurance license number or their national producer number, which every agent has. I typically get hung up on then because they don't have one, which means they're not really insurance agents.
Oh.
So be very careful. If they tell you that they're your carrier, the insurance company that you have your plan through, if they say, this is your insurance agent, I'm sorry, who are you? Your insurance agent. They're not. So you want to hang up. Find the number on the back of your card for your member service or your client services, or you want to hang up, tell them you'll call back, find your agent's phone number and call your agent directly, and make sure that's who's calling you. Because a lot of those things are scams to tell you, we can give you free food or we can give you money back, and it's not accurate. They're getting you on the phone to get you talking, and then they want to make a plan for you. It's very, very rare, though some cases there are extra benefits that you might receive. That's a very small portion of people compared to what's actually available for you. But they're just trying to get you to talk.
Especially right now, in that time, people know that this kind of stuff is going on, these conversations need to be had, and a lot of times they're on there with a sense of urgency.
Correct. Yep, that's how they get
scare you.
Yes. And there's a lot of things happening this year that's outside of the normal, so that's another way they're getting you. They want you to be afraid that you're not going to have coverage. Hang up, call your member service number, reach out to a licensed agent.
You were saying, though, even in the mail.
I had a client bring a bunch of mail in, and the return address looked like the Social Security Administration. The logo was so close, and the address was pretty close to the state and city that it would come from, that I actually walked up to another agent, and I'm like, this doesn't look real. And he was like, no, this is definitely not. But it takes us a few minutes to go over all the information to see if we can find the flaws in it. So if you don't know, don't put your personal information on anything. Reach out to a trusted licensed agent. Call your member service number, because we don't want anyone to end up with not having the coverage they need, and then they go to the doctors or they try and pick up a prescription and they can't. And we're seeing that happen even outside of open enrollment, that they're moving people and losing coverage they need.
Yeah, that's really scary.
It is.
The other thing is some of the Advantage plans dropping coverage, and
yes, there was some companies that terminated some plans. There's still options. Those companies are still available. You just have to make a new choice. So this is a great time for scammers to call and target you. So that's another thing that they're kind of putting that sense of urgency. Did you get your letter? But they're not very specific about what they're talking about because they don't know who your carrier and things are. So that's why it's so important to make sure you know who you're talking to. And the last application you put in on open enrollment is what sticks for the whole next year. So that's why you've got to make sure you know who you're talking to and you're not making changes thinking that, oh, I met with my agent, my application didn't go through, there was a glitch, because you can always say there's a glitch with a computer system and everyone's going to believe you. So then they get you to put a new application through, it's a different plan, it's a different carrier, you don't know what's happening. And that's why it's so important to make sure you're in good communication with your agents or the member services that you're using to make sure that's really who you're talking to. If they insist that you can't hang up and call them back, it's probably not real. They may say, oh, you know, I'm going into an appointment, or, you know, leave a message and we'll call you back when we're available. But if they're not willing to let you call back, that's probably a good sign that something's going on.
Yeah, so be on the lookout for some of those red flags.
Yes.
Don't take things for face value.
Correct. Yes, make sure you know what's happening and who you're talking to.
Yes, and if people want to work with a trusted advisor, that's kind of why you're getting these phone calls, right? Handling this and helping people.
Correct.
In a critical time.
Yep. The Health Insurance Place is located inside Station Medical Center. We do not charge for our services. That's another way to very quickly know if you're talking to a legitimate agent, as long as they're not charging you for their services. You can give us a call in Altoona at 814-201-2829, or we do have a Johnstown location if that would be better for you, and that's 814-266-8383.
All right, good stuff, Kate. Really,
thank you so much
people
for
need
having
to
us.
be educated, informed of what's going on, and thanks for keeping us straight.
Yes, thank you.
All right, coming up, we'll give back in a bit.